Hi, this is nursing students Gabby MUSCARELLA, CAITLYN LYON, Ross PIXLEY, Casi McDaniel, Grace MANNA, Maddie McInturff, and SKYLER POLLAK, and this is our dashboard presentation on pain. Hi, my name is Gabby MUSCARELLA, and for the first slide, I'll be talking about the overview of quality safety measures in organizations. A quality dashboard monitors the quality of patient care. It is an excellent way to communicate information throughout an organization. Quality indicators are standardized evidence-based measures that can be used to measure and track clinical performance and outcomes. There are different types of quality indicators. Prevention quality indicators identify issues of access to outpatient care, including appropriate follow-up care after hospital discharge. More specifically, it uses data from hospital discharges to identify admissions that might have been avoided through access to high-quality outpatient care. The inpatient quality indicators provide a perspective on quality of care inside hospitals. The patient safety indicators provide information on potentially avoidable safety events that represent opportunities for improvement in the delivery of care. More specifically, they focus on potential in-hospital complications and adverse events following surgeries and procedures. Lastly, the pediatric quality indicators focus on potentially preventable complications for pediatric patients treated in hospitals and on preventable hospitalizations among pediatric patients. Dashboards have data presented with a single page, usually have a visible display of performance indicators, can be easily understood by all staff, and can be easily updated. It can be customized to drill down to individual unit data or show organizational objectives as a whole. Data is collected through the electronic health record for the dashboard.
This slide is about evidence-based practice interventions, where the first half is based on pain in children during chemotherapy. This was a trial that was done with patients that were under the age of 18 and their parents. And one of the first things that they did was an art therapy, which improved the quality of life, which used paintings and drawing and dance, and less pain was reported due to the help of distractions and promoting creativity. Another form of another intervention was distraction, and this was able to let children immerse themselves in another world so they weren't so focused on the situation, and this one also helped decrease pain. There was another one that was touch therapy. It was proven that holding the hand of a mother gave positive experiences, helping decrease pain. There's also antimodal cognitive behavior therapy, which is a guided imagery and coached relaxation taught before procedures, which help reduce the pain while procedures were happening. This way, children could kind of detach themselves from what was going on in the current situation they were in and the painful thing that they were going through. And also, hypnosis was a proven thing to help children. It had very positive results. It actually had the most positive results out of all of these, and it was used to create a calming experience before the procedure and help decrease pain. These are 5 that actually had a positive outcome. There were other ones in this article that they had tried but didn't actually decrease pain themselves, but these were ones that were proven to decrease pain. Now on the other side, we have an actual worldwide organization intervention that these are carried out by every hospital all over the world, and this is called the WHO letter for cancer. So the first one is by mouth, and this is whenever the pain medication is given. And then we've got by the clock, and it should be a constant and fixed intervals given earlier. And then before the previous drug is worn off, that way they're not in pain. This way we keep that pain at a minimum. And then we have the ladder, which is a non-opioid. Then we go to codeine, and then we go to opioids, and then we go to some psychotropics. That way we're not going straight to the hard stuff. We're staying more in the lower side and work our way up according to the patient's pain. And then for the individual is the right dose according to the patient. Some patients need a higher dose than others, and while other people just need a low dose to keep their pain at a minimum. This is a big thing because this has been known to reduce the pain in 90% of patients that is given to, but one attention that needs to be given is that you need to give this routine to parents, to the patients and families and parents. That way that they know the schedule and they can keep them on them when they're not just in the hospitals as well. And another key thing in this is keeping this a regular routine for them. This is highly important because it's going to keep their pain rate lower. So the first half is our evidence-based practices, and then the second half is the widely used interventions that are used worldwide.
This is Ross, and after analyzing the data from the chart provided, I was able to recognize that in the first quarter, 24 patients were assessed using the pain scale rating tool. In the second quarter, 25 patients were assessed. In the third quarter, 30 patients were assessed. And in the fourth quarter, it drops back down to 28 patients were assessed using the pain scale tool. The goal for the hospital is to assess 35 patients' pain each quarter. The hospital-wide pain ratings done are consistently higher than the unit-specific data. This could be due to the lack of physical pain on their unit. It could be related to the nurse's commitment to using the pain rating tool, or whether the nurses are incentivized differently on other units. It's important to measure pain ratings for multiple reasons. Pain management is critical to the patient's healing process, as well as proper administration of analgesics. The pain rating scale is the most accurate and useful tool of the patient's perception of their own pain. The consistent use of this tool allows the nurse to keep pain under control, increasing adherence and tolerance for OT, PT, and performing ADLs. An evidence-based article that I found indicated that unmanaged pain extends patients' length of stay at hospitals. Patients with pain over the score of 7 are 60% more likely to remain in the hospital for 10 to 30 days. 70% of patients with pain managed at a 5 leave the hospital in the first 7 days. CMS has taken steps to encourage naloxone, which is the reversal agent for opiates, to be lower cost and co-prescribed for individuals that are at risk for overdose. In regards to reimbursement, CMS no longer uses pain management as a factor to do so. This was removed because it began to incentivize overprescribing pain medication.
This is Grace, and I will be talking about applying the electronic health record to the patient as a way to facilitate pain management. There are many different methods of data collection to help facilitate pain. In the article, Neuropathic Pain in a Primary Care Electronic Health Record Database, the first way the EHR was used in this study was to develop methods of recognizing patients with neuropathic pain. The way that the EHR facilitated data collection in this study was by developing approximations of the occurrence of neuropathic pain among patients in an electronic health record, and also by describing the demographic characteristics and health utilization resources of these patients. Other factors that were measured include age, general practitioner visits, and specialist referrals. In this study, the way the electronic health record facilitated quality improvement of studying neuropathic pain was by recommending methods for identifying patients at risk for neuropathic pain in a primary care EHR database. It was found in this study that the electronic health record was a very useful and important tool for identifying those at risk for pain and improving pain management.
This is SKYLER. BSN prepared nurses have an important role in facilitating policy and procedure changes through taking on leadership roles and providing education for other nurses. Education will cover various topics, such as what signs to look for in patients who do not outwardly express or exhibit signs of pain. Some patients do not vocalize their pain, therefore, nurses must be familiar with different coping styles and the psychosocial aspect of expressing, along with different cultural factors that play a role. Monthly staff meetings will start out formal to address ways to properly educate patients on the use of patient-controlled analgesia, pharmacological and non-pharmacological methods to treat pain. Towards the end of the meeting, the discussion shall be informal so that nurses can openly converse about goals and expected outcomes for patients with pain. This is an excellent time for nurses to discuss what they believe should be implemented in regards to pain management based off methods deemed useful, as well as what procedures they believe should be altered or removed entirely. Time management is an important aspect of patient care and pain management. Prioritization and triage is about setting priorities and determining which patient takes precedence based on the severity of their condition and their pain rating. Delegating tasks is an excellent source for time management, but because nursing is more about critical thought, education, and vitals on unstable patients cannot be delegated. Only certain tasks can be delegated to assistive healthcare personnel. This must be clearly defined to avoid issues. Measurement of pain is vital for the proper management as well as the best way to determine if treatments given were effective. Patients' length of stay and discharge time at the hospital are important outcome measures used in health services research. Record of such details and treatment can be found in the electronic health record. There are a number of ways to collect data to see if education was effective, but utilizing the EHR for statistical analysis and congruence with patient surveys proves to be the most favorable method.
This is Madeline McInturff, and I'm going to be talking about informatics in nursing. The role of informatics and the implication in patient care and outcomes. In a study on documentation of pain management, Briggs and Dean found that 57% of those who reported pain had no corresponding information about this condition in their records. This shows that nurses are not using informatics effectively. Informatics can improve patient care and outcomes by allowing data to be compiled and evaluated to find better treatment options for patients. How can informatics be used? Informatics can be used in many ways. It can be used to chart, to gather data, and to store a patient's entire past medical history. How is data mining relevant to this topic? Data mining is relevant because we are always trying to find new ways to treat pain. Data mining allows researchers to pull information from patient charts and other patient data that is important and relevant to their research. Recommendations for the use of informatics. A recommendation I would make would be to use informatics to develop different pain management techniques. I also recommend using informatics to educate nurses on the importance of documenting pain.
Hello, my name is Casi, and I will be talking about pain and the summary of pain.
For my group, I was chosen to do the summary part. I have a couple of questions that I've answered in my slides. The first question is, what is the role of performance measures? The performance measures significantly related patients' pain throughout the first and second quarter. The role was to evaluate the impact that external influences could have affected pain of a patient and how many patients that were in pain currently. Number 2, why is the observing for performance deficit important? It is very important to measure pain deficit because you get to see how pain management is controlled by a nurse in the work facility in order to decrease the length of stay at a facility. Number 3, how could using best practices improve the deficit? It is understood that the best practices in order to care for pain is to understand how to classify pain's present and quality, administering medication effectively, and treating the pain appropriately. An electronic health record is a very good tool to identify patients in pain and help to improve pain management overall for the patient. Another statement to go along with best practices to improve deficit is to make sure to educate patients on the use of PCA pumps and how to use the pain scale. Below that, I had found a quote. Reporting medication errors is problematic due to the fears of reprisal, intimidation, or disciplinary actions. The next question I answered was what is the financial implication for hospitals? As a nurse, it is sometimes a hard task to manage pain. Pain is one of the biggest pieces of subjective data in healthcare. Financial implications for hospitals are to make sure that pain is controlled in order to decrease the risk of having any lawsuits or changes in healthcare that can lead to any type of deficit. Some examples given for evidence-based practice interventions for children specifically introduced in our article are things such as multimodal cognitive behavioral therapy, hypnosis, art, distraction, and touch therapy. As far as post-operative care is stated in our slides. Many of the pain assessments were based off the patient's own report rather than any nurse assessment being reported. To kind of sum it all up, I found this quote, and it states, the aim of this study was to describe nursing documentation of post-operative pain management and nurses' perceptions on the records in relation to current regulations and guidelines. Thank you.